What size needle should I use for semaglutide injections? If you're starting semaglutide treatment, you might be wondering about needle sizes. Let's break down what you need to know about the needles used with these medications. First, it's important to understand that semaglutide comes in different formulations with different delivery systems. If you're using Ozempic, you'll be working with a multi-dose pen that requires attaching a separate pen needle before each injection. Wegovy, on the other hand, comes as a single-dose auto-injector with a built-in needle that's already integrated into the device. For Ozempic, the pen needles commonly used are 4 to 6 millimeters in length and 31 to 32 gauge in thickness. Your healthcare provider or pharmacist will specify which exact needle product is right for you. Now let's talk about what those numbers actually mean, because understanding this can help you have better conversations with your healthcare team. The length measurement, those 4 to 6 millimeters, determines how deep the needle penetrates. Semaglutide is what's called a subcutaneous injection, meaning it needs to be delivered into the fatty tissue layer just beneath your skin, not into muscle. The gauge number refers to the needle's thickness, and here's something that surprises a lot of people. Higher gauge numbers actually mean thinner needles. So a 32 gauge needle is thinner than a 31 gauge, which generally translates to less discomfort during injection. Research has shown that 4 millimeter needles work well for most patients across different body types. The key is getting the medication into that subcutaneous fatty tissue layer. If a needle goes too deep and reaches muscle, it can affect how the medication is absorbed. If it's too shallow, you might experience leakage at the injection site. Now here's something really important. This video is educational only and is not medical advice. Do not use this video to learn how to inject your medication. The actual injection technique, including things like insertion angle and timing, should be demonstrated by your healthcare professional. They'll walk you through the specific steps using your device's instructions for use. Every device has its own specific technique requirements, and your prescriber or a trained nurse should show you exactly how to use yours. If you're using a compounded semaglutide product or a different device than the brand name options, don't apply this general guidance. Compounded products and alternative devices may have completely different specifications and instructions. Always follow your prescriber or pharmacist's specific directions for your particular product. Let's talk about some important safety considerations. Never reuse needles. Each injection should be done with a fresh, sterile needle. This isn't just about comfort, it's critical for preventing infection and maintaining medication sterility. And never share your pen or needles with anyone else, even family members. There's a real risk of transmitting bloodborne pathogens. When it comes to disposing of used needles, you need to use an FDA-cleared sharps container. Don't throw loose needles in your household trash. If you don't have a sharps container, ask your pharmacist where to get one, or check with your local waste management about sharps disposal programs in your area. You should contact your healthcare provider if you notice signs of infection at an injection site, like increasing redness, warmth, swelling, or pain. Also reach out if you're experiencing persistent bruising or bleeding, or if you're having difficulty with your injections. And if you have any concerns about whether your medication is being absorbed properly, that's definitely something to discuss with your healthcare team. When you meet with your doctor or pharmacist, they can help you understand which needle specifications work best for your individual situation. Factors like your body composition and your comfort level can influence what's most appropriate for you. They'll also show you proper technique for your specific device and answer any questions you have about the injection process. So to recap the key points, Ozempic pen needles are commonly 4 to 6 millimeters in length and 31 to 32 gauge in thickness, as specified by your prescriber or pharmacist. Wegovy has an integrated needle you don't select. Always use a new needle for each injection, never reuse or share, and dispose of used needles in an FDA-cleared sharps container. Most importantly, get hands-on training from your healthcare professional and follow your device's instructions for use. Remember, needle selection should be individualized by your clinician or pharmacist based on your specific needs. This information is educational and doesn't replace personalized medical advice or proper injection training from your healthcare team. If you found this helpful, hit that like button and subscribe for more evidence-based health information, and drop a comment below if you have questions to discuss with your healthcare provider.